Hello YouTube. A healthy lifestyle is more important than predisposition. Scientists have named 7 rules for stroke prevention. Scientists have named 7 healthy habits that can have the risk of stroke, even when there is a genetic predisposition to it. In our time, scientists have learned to explore the genetic predisposition of a person to certain diseases. For example, now doctors can quite accurately say who has a higher risk of developing cardiovascular diseases and, in particular, to a stroke. We cannot change genetics, but we can reduce this risk and live longer and healthier lives. The publication cites the results of a study published in the Journal of the American Heart Association, which suggests that proper nutrition and regular exercise can even offset any genetic risk. Genetics versus healthy lifestyle. The experts tracked the health status of 11,568 adults aged 45 to 64 for an average of 28 years. Participants with the highest genetic risk and the worst heart health had the highest lifetime risk of stroke, about 25%. But for those who adhered to the 7 rules for stroke prevention, this rate fell by 30 to 43%. As the analysis of the results showed. Compliance with the rules also increased life expectancy without a stroke by almost 6 years. The healthiest group, which included people leading a healthy lifestyle without a predisposition to stroke, had the fewest cases of stroke at 6%, while those who followed the rules of prevention the least had a stroke risk of about 57%. According to lead author Professor Miriam Fornage, a geneticist at the University of Texas at Houston, the results are encouraging. They show that regardless of your genetic predisposition, you can avoid a stroke and live a long healthy life if you lead a healthy lifestyle and adhere to the rules of prevention. What 7 simple rules of life can reduce the risk of stroke? Eat properly. Exercise regularly. Do not smoke. Monitor body weight. Maintain normal blood pressure. Control cholesterol. Control blood sugar levels. Stroke. 8 risk factors. Factors that, on the contrary, can provoke a stroke are: age, high blood pressure, smoking, obesity, sedentary lifestyle, diabetes, atrial fibrillation, family history and history of stroke or microstroke. Stroke, 5 main symptoms. It is very important to consult a doctor at the first symptoms of a stroke. This will significantly increase the chances of survival and recovery. Doctors call the main symptoms of a stroke: sudden numbness or weakness of the face, arm, or a leg, especially on one side of the body; sudden confusion, trouble speaking or understanding; sudden blurred vision or blurred visioning one or both eyes; sudden trouble walking, dizziness, loss of balance or coordination; sudden severe headache with no known cause. A stroke often leads to death and profound disability, so it is very important to assess the risks and adhere to the 7 rules of prevention, even when you do not have a hereditary predisposition to stroke. Stroke prevention. Prevention of stroke is maintaining a healthy lifestyle, as well as taking medication if necessary. Most risk factors can be kept under control. It is in your power to reliably protect yourself from ischemic and hemorrhagic stroke. Measures to prevent stroke have certainly proven their effectiveness. In Western countries, since 1972, the risk of dying from this disease has decreased by 50%. A healthy lifestyle has already become the norm there. People try not to eat junk food, quit smoking and lead an active lifestyle. The risk of stroke increases over the age of 65. Men are more likely to have a stroke, but women are at higher risk of dying from the disease. If you have already had a stroke, then the risk of a second catastrophic cerebrovascular accident increases 10 times. People whose close relatives suffered a heart attack or stroke at a young or middle age need to pay increased attention to the prevention of cardiovascular diseases. Risk factors for stroke that can be controlled include high blood pressure, elevated blood cholesterol, cardiovascular diseases, smoking, diabetes, obesity, hormonal pills for women, alcohol abuse. Doctors recommend a low-carbohydrate diet to eliminate risk factors for cardiovascular disease, including stroke. This diet quickly normalizes blood pressure, cholesterol and triglycerides in the blood. Whatever style of eating you choose, do not eat sugar, as well as foods containing refined carbohydrates, variety of confectionery. All expert nutritionists agree that junk foods are bad and should be eliminated from the diet. Medicines to prevent stroke are pills for hypertension, as well as drugs that thin the blood, reduce its viscosity and block the formation of blood clots. Natural blood thinners are garlic, turmeric, ginger, vitamin E, fish oil, omega-3. In the primary prevention of stroke, the emphasis is on a healthy lifestyle, and in the secondary, on medications. At the same time, no one cancels a healthy diet, quitting smoking and feasible physical activity. Keep your blood pressure under control. Have a blood pressure monitor at home and use it often. Do not take any pills on your own initiative. Use them only as directed by your doctor. The patient needs to be highly motivated and lead a healthy lifestyle, otherwise the medication will be of little use. Physical activity is vital for all adults. Walk at least 20 minutes a day, to and from work. Set aside time for this. Reduce the use of personal car and public transport in favor of walking. If you have a heartbeat, diagnosed with heart rhythm disorders, take it seriously and diligently treat this disease. Learn to manage stress, resolve conflicts peacefully, without scandals. And remember, by leading a healthy lifestyle, you reduce the risk of stroke, heart attack, many types of cancer, joint problems and other age-related diseases at the same time. Prevention for people with risk factors. Risk factors for stroke include age. The older it is, the more likely it is to have a stroke, and heredity. These factors cannot be influenced. Other factors, smoking, high blood pressure, blood cholesterol, arrhythmias and some heart diseases, the presence of stenosis, narrowing, of the vessels of the neck due to atherosclerosis, diabetes mellitus, can be eliminated. Smoking, or taken under control. Other factors, using the measures prescribed by the doctor, laboratory tests, instrumental examinations, medication. Such control can significantly reduce the likelihood of a stroke, increase life expectancy without a stroke, so measures to influence risk factors are mandatory when they are detected. The doctor should identify risk factors and choose the method of influencing them at the request of the patient. Mandatory stroke prevention measures for people with risk factors are recommendations for a healthy lifestyle for all people, but with specifics in relation to physical activity, which the attending physician should explain. What happens if a stroke occurs? In the acute period of a stroke, about 25% of patients die, another 30% die during the first year. After a stroke, no more than 20% of surviving patients fully recover, the remaining 25% remain disabled. That is, in the event of a stroke, a completely favorable outcome is observed in 1 out of 4 patients. About 1 out of 4 patients also survive with a disability. The possibilities of preventing disability by medical measures in stroke are limited. Even with timely treatment, it is possible to achieve a complete recovery of a patient after a stroke only in 50% of cases, says the director of the Federal Institute of Stroke, head of the Department of Fundamental and Clinical Neurology of the Russian State Medical University, corresponding member. RAMS Professor Veronika Skvortsova. However, the quality of medical care has a more than significant impact on mortality. Among European countries, the majority are countries where mortality from stroke is 5-20 times lower than in Russia. World data show that many people can hardly avoid a direct encounter with a stroke. The trouble will overtake either the person himself or one of his relatives. With this in mind, the most important of the effective measures for the prevention of cardiovascular disease and stroke, necessary and available to everyone, is to follow easy-to-implement measures of a healthy lifestyle. Elimination of risk factors when they are detected requires contacting medical institutions and cooperation with the attending physician. The use of such a strategy in the prevention of stroke can significantly reduce the likelihood of its occurrence in everyone. Thank you for your time and attention listening to me. Don't forget to hit the like button and subscribe to our channel. You can also click the bell sign to be informed about new videos. Have a great day.